Buhat magandang araw po sa inyo lahat. Ako po si Dr. Buenaventura. Unang-una po sa lahat, maraming po salamat sa Philippine Medical Association for the invitation to be one of your speakers today. A special shout out to the Philippine Psychiatric Association and to the San Juan Medical Society. So I'm very happy to participate in the PMA Medicine Week celebration. So for today, I will be talking to you about coping with loneliness during the pandemic. These are my objectives for this lecture, and throughout the lecture, we'll be going through them one by one. Let me start off with a situationer. Early last year, a study in China during the COVID pandemic found the overall prevalence of anxiety, depressive symptoms, and poor sleep had remarkably increased. Particularly for anxiety and depression, the prevalence increased by about 5 to 10-fold. In the United States, a similar picture can be seen. Comparing data from a year ago, represented by the orange bars, versus the present, represented by the red bars, we can see that the symptoms of anxiety and depression have also remarkably increased. In the Philippines, we don't have a lot of data, but a study that I did with a colleague last year at UERM, in which we looked at the psychosocial impact of the COVID-19 pandemic on the mental health of elderly Filipinos, we saw that the prevalence in our subjects of anxiety, depression was about 8 to 9%, much higher than the general overall prevalence of about 3% in the population. In an online survey done at the Philippine General Hospital and published early this year in the Journal of Affective Disorders using scales for depression, anxiety, stress, and the impact of events, the authors found the following: that 16.3% of the respondents had moderate to severe psychological impact, 16.9% had severe depressive symptoms, 28.8% had moderate to severe anxiety levels, and finally, 13.4% had moderate to severe stress levels. Based on experience with prior pandemics and disasters, we have learned that prospective longitudinal studies have demonstrated that heightened stress responses during and in the aftermath of a threatening event are associated with adverse physical and mental health. We have also learned that the constant fear, worry, and stress can lead to adverse long-term consequences, such as deterioration of social networks and economies, stigma and rejection, anger and aggression, mistrust, and paranoia. I would like to emphasize, however, that fear, worry, and anxiety are common or typical responses to a major health crisis, together with known psychological reactions of stress, loneliness, and agitation. It is important to remember that some groups may be more vulnerable than others to the psychosocial effects of pandemics, in particular people who contract the disease, those at heightened risk for it, including the elderly, people with compromised immune function, and those living or receiving care in congregate settings such as nursing homes, and people with pre-existing medical, psychiatric, or substance use problems are at an increased risk for adverse psychosocial outcomes. Healthcare providers are also particularly vulnerable to emotional distress in the current pandemic, given the risk of exposure to the virus, concern about infecting and caring for their loved ones, shortages of personal protective equipment, longer work hours, and involvement in emotionally and ethically fraught resource allocation decisions. But what is also important to remember is that after disasters, most people are resilient and do not succumb to psychopathology. Indeed, some people can find new strengths in these situations. People can and do manage even in the midst of dire circumstances. We do know that some of these fears and reactions spring from realistic dangers, but many reactions and behaviors also come out from various reasons. Aside from what I have already mentioned, what are the other causes of all the anxieties and loneliness that we are experiencing? There are certainly other causes, but these are just a few. There's uncertainty about the future. 1 month or 2 months or even 1 year from now, we don't know what's going to happen. Thinking that we or our loved ones will get sick because we are dealing with a particularly contagious illness. Feeling powerless, helpless, and hopeless, not being able to do what we want to do. financial concerns. There's been an increase in the risk of unemployment, and a lot of individuals have experienced a huge financial downturn as a result of the pandemic. There's an overwhelming amount of information, particularly fake news and conflicting scientific information that makes us feel very overwhelmed and confused. And finally, feeling isolated or away from loved ones can be a very detrimental factor as far as the development of loneliness during the pandemic. We need to understand that aside from fear, worry, sadness, and loneliness, we also see other emotional and behavioral responses, including a very common one that we're seeing not right now would be sleep difficulty. There are individuals who've developed negative coping and risky behaviors such as substance use. There's increased irritability, impatience, and anger. So aside from sadness and loneliness that we are talking about, there are other psychosocial or emotional reactions that individuals manifest as a result of the pandemic. And that's the reason why, in the context of COVID-19, it is now recommended that psychosocial assessment and monitoring should include questions about COVID-19 related stressors, such as exposure to infected sources, infected family members, loss of loved ones, and physical distancing, secondary adversities such as economic loss, psychosocial effects such as depression, anxiety, psychosomatic preoccupations, insomnia, increased substance use, and even domestic violence, and finally, indicators of vulnerability such as pre-existing physical or psychological conditions. In this pandemic, we have frequently said that it is okay not to be okay. But when is it not okay to be not okay? Now, this can be a complex task, but what is critical to note is that physicians need to have a high index of suspicion. As I've said earlier, most individuals will be resilient, but they can still benefit from certain strategies that can allow them to cope better in this pandemic. We have mentioned that it is normal to be confronted with stressors because they are a part of our everyday lives. But how do we know when it is beyond normal already? Let me emphasize that when we talk about these kinds of emotional states, we have loneliness, grief, and depression to consider. Loneliness would be our normal day-to-day sadness, feelings of uh, sadness that we experience, for example, as a result of what we're going through. Grief, on the other hand, is specifically an emotional reaction secondary to the loss of a loved one or a loved object. And then finally, when we say depression from a psychiatric perspective, we are specifically referring to a clinical syndrome, okay, that would require more specific types of treatment, such as psychopharmacology, psychotherapy, and a combination of both. So in this instance, we would like to focus primarily on loneliness, but it's still very important to consider in terms of how do we know when it is beyond normal already. So how do we know that the loneliness that we are feeling is not clinical depression? So in my case, I would look in terms of three areas of our overall functioning, which would include personal functioning as it relates to self-care, social functioning as it relates to interpersonal relationships, and occupational functioning as it relates to work, school performance. I would also consider the extent and severity of the manifestations. Let us look at certain examples. For example, in terms of personal functioning, this could manifest as poor appetite, poor hygiene, insomnia, loss of interest or pleasure in usual activities. Social functioning, becoming isolated or withdrawn, refusing to interact or communicate with others, including close family members and friends. And then occupational functioning, inability to concentrate at work or in school, unable to meet obligations and expectations. And then finally, extent and severity of manifestations can include presence of additional symptoms such as anger and agitation, with a duration extending beyond weeks or even months. Now let's expand on in terms of how can we help the individual. So the main purpose of this lecture today is to talk about coping with the loneliness that we are feeling during the pandemic. But these practical tips can also be useful for individuals who are experiencing a lot of anxiety and stress. So the most basic recommendation would be to practice self-care. Eat right, hydrate, sleep well, exercise, maintain proper hygiene, and if one is on maintenance medications to ensure that we take those medications. Number two, to focus on timely and accurate information from reliable and credible sources. We don't need to read on everything or listen to everything. We can just limit the exposure of information to just a very few, okay? And then limit mass media and social media exposure, because particularly for social media, these are the greatest sources of fake news, and therefore it would be very prudent to limit our exposure to this. Okay. Educate oneself and follow recommendations. So that's why it's very important to be able to select credible sources of information that will help guide us in terms of how we behave. For example, right now, we already know how to properly use face masks, face shields, and also do hand sanitation. And then we need to reach out and connect with family and friends, because isolation can be one of the biggest factors that can lead to loneliness, particularly if we're away from our loved ones, or if we are unable to connect with anyone else. But it's also very important that if you know of someone in the community who's isolated or alone, then please let us reach out to them as well. And then engage in enjoyable activities, hobbies, and crafts. For example, we know that there's a lot of free online courses that one can take. But aside from that, it would be a very good idea to be able to interact with family members during this time, because a lot of us are at home, particularly during the ECQ and MECQ. So that why not have meals together, so that we can take the time to be able to talk with each other. Next would be to think positive, be positive, and act on things one can control. I mentioned earlier that the feelings of loss of control is one of the factors that can lead one to develop feelings of loneliness. So that it's very important to, for example, be more hopeful that the situation will turn out well, and that we need to be able to act on things that we can control rather than ponder on things that we have no control over. We have to make decisions, plan, draw up a schedule, develop a routine, but be spontaneous as well. I think this is very helpful because people have been, for example, isolated or quarantined at home, and even if they're working from home or studying from home, they often feel a sense of disorientation, for example, as to what to do. So I would always advise these individuals to set up a routine or a schedule on a day-to-day basis and follow it as best as they can. Of course, they can deviate occasionally, but it would be very helpful to have that kind of a routine. Be productive, do something that can lead to positive outcomes. One can help or even volunteer, and then donate or share our resources as well, because this can help elevate our feelings of self-esteem. Increase self-awareness. This is an example of what we would call mindfulness. We'll talk a little bit about this later on. But for example, at the end of the day, one can focus on monitoring one's thoughts, actions, and feelings. So that's important to have a quiet time, to take the time to be able to pause and listen. And then look for one or a few trustworthy individuals who can listen, advise, guide, and help. All of us need someone who will be able to listen to us, who will allow us the opportunity to be able to vent or open up about our frustrations and fears. Okay. And in the same vein, if we expect others to be able to help us in that way, then we should be able to listen to others as well. And then finally, I'd like to share a special group of tips. Some of these may not be applicable to everyone, but in my situation, I find all of these very, very helpful. The first one is pray, either in the silence of our hearts, in one global voice. Meditate. Prayer has often been very helpful because a lot of people, to them, prayers seem like meditation that give them a sense of calm. We need to be kind to ourselves and to others as well, because this will help us minimize the anger or irritability that we feel. I also feel that laughter is really truly the best medicine that we can have at this point. We need to be able to find the humor in the situation, because it can help break the cycle of negativity. So whenever you feel very stressed or lonely, you should take the time to be able to divert yourself, do something that can give you a sense of pleasure, or there's a lot of things that can we can catch online at this point. And then finally, let's look in terms of finding meaning of what we are going through. Try to understand what it is that's happening to us so that we'll be in a better position to be able to move forward. Okay. There are other things that we can do. I alluded to some of this already. Like mindfulness is the psychological process of purposely bringing one's attention to experiences occurring in the present moment without judgment, which one develops through the practice of meditation and through other training. Our negative thoughts are also called cognitive distortions, and we must become aware when that happens so we can check and correct it. The last three, deep breathing exercise, progressive muscle relaxation, and visual imagery, all can be done simultaneously, like what we would call an autogenics session. It will be easier and more helpful to listen to a recording while doing this alone in the comfort of a quiet room with soft music playing. I would suggest you look at the YouTube because there's a lot of uploaded videos right now that can, that you can listen to. Just search for autogenics or deep breathing exercises or even mindfulness and meditation, and on all of those relevant videos will come up. Now, I mentioned earlier about limiting ourselves to credible resources. So these are the primary resources that I would recommend, of course. So if you need information about what's going on as far as the COVID-19 pandemic is concerned, look at the WHO, United Nations, and even the Department of Health for credible and reliable information. If one needs additional help, there are telemental health resources that one can avail of, but it would also be very helpful to access our crisis hotlines. There are several crisis hotlines that are already available in the country right now. We have one from the In Touch Foundation called the Crisis Line, another from the Natasha Goldborn Foundation called the Hope Line, and then finally the NCMH Crisis Hotline or the National Center for Mental Health in Mandaluyong. All of these hotlines are available 24/7. They are free and confidential, and they are staffed with trained counselors. So the individuals going to respond or answer your call are not just your routine or normal telephone operators. You will be transferred to a trained counselor. And in the case of the National Center for Mental Health, if needed, you can be referred to a psychiatrist who will be able to help you understand what you're going through. So I hope you can take the time to take a screenshot or a picture of these numbers, or if you're unable to, you can Google them at any time because these are numbers that can be, very helpful. And as I've mentioned, they are available 24/7. And I just like to highlight that with the NCMH Crisis Hotline, they have a toll-free landline to landline number that you can call 1553. This is available via landline, okay? And it's toll-free in Luzon. So if you're anywhere in Luzon, then you can just dial 1553 and then you can be connected to the NCMH Crisis Hotline. But just be patient because there are a lot of calls. The number of calls have doubled over the past year. So, just wait until your call can get through. If you need additional numbers, you can go to the Facebook page of the Psychological Association of the Philippines. They have provided a list of other centers nationwide offering free counseling. So just check it out. Now, in conclusion, allow me to end with the following statements. That COVID-19 is not just an infectious condition affecting our body, but it has had a very significant impact on other aspects of our lives as well. It is therefore important to address the behavioral, psychological, emotional, and social consequences of this disease. With proper support and cooperation, we will be able to rise above this crisis and move forward with the goal of being able to thrive, not just survive. And we always need to remember that there's no health without mental health. Allow me to end with a quotation from Mr. Antonio Gutierrez, the Secretary General of the United Nations, in which he mentioned that mental health services are an essential part of all government responses to COVID-19 because it is widely established and recognized that psychological, emotional, and behavioral responses are part of the responses to any pandemic, including the COVID-19 pandemic. And with that, I'd like to end my lecture and to thank you for your kind attention. Magandang araw po muli sa inyong lahat at maraming salamat po sa inyong pakikinig.